Hi, I'm Ruth Hansten. I'm your instructor in the Professional Practice Program, and I'd like to now discuss Section 3 of your Professional Practice Specialist Manual. So if you're with us, you're in your portfolio on Section 3. So let's talk about some of the activities that we are going to be engaging in. Remembering that what we're doing in this program is helping you develop into that internal consultant in your organization, so that not only are you a specialist and an expert in all the elements of professional practice, but that also you can be a resource to others and to help really assess what's going on in your organization. So right now we're going from Sections 1 and 2, where we got started and we began our personal assessment and reflection, learning a little bit more about ourselves and developing some goals. Now we're actually looking at what's going on in our organization and comparing that to what we read about in the delegation book, in the National Council of State Boards of Nursing and the ANA Statement on Delegation and Supervision, and really comparing that with some of the tools that we've given you to do some assessment. So you can see that in this case it's page 18, depending on what iteration of the manual you have of the portfolio, but we are asking you to read Chapter 2 in the ROC Planning and Implementation Manual, and then really look at clinical delegation skills, chapters 1 through 3, and then those of you who already know that material in depth, obviously you can skim that. The people that really need to develop their delegation skills and understand that more clearly for making assignments and for developing care delivery models that work more effectively, you'll need to go into more detail in your reading. We ask you to go online and look at the National Council of State Boards of Nursing and the ANA Joint Statement on Delegation. Excellent resource, excellent resource. And also you can look at the last part of the portfolio, which is the appendix. We have the toolkit in there for your indicator tools that you can use for assessment and evaluation of progress. And also we have the second part of the appendix, we have a CE, which is called RNs and Assistive Personnel, the 5 Rights of Delegation and Supervision. So that's something you can read, and you can also get CE credit online if you'd like to. So here we are. Let's go to our first worksheet. So Worksheet 6 is a review of the 3 elements of relationship and results-oriented healthcare, the philosophy that we have, and then the 10 best practices. So there are 3 elements of the professional practice program. The first thing is we believe all care has to be based on the foundation of patient and family results. Secondarily, we believe that then we use critical thinking and problem solving to help the patient and family get to the results that they want to achieve. And thirdly, we must work effectively in interdisciplinary teams. So underneath each of those 3 elements, there's specific skills that we're developing in this program to help people be expert. For example, how do we know the patient? How do we do that one-to-one interview with them? How do we also develop our critical thinking skills? So you're going to be doing a critical thinking problem during the course. And then we really look at things with our interdisciplinary teamwork, such as conflict resolution and how we communicate and give initial direction and checkpoints and huddles and debriefing and feedback. Those kinds of skills are absolutely essential for patient safety. So Worksheet 6A talks about our 10 steps of ROC. And again, we base all of our care on the 10 steps of ROC. So we always have to look at what the patient and family wants. But once you know the patient's and family's 4 Ps, or purpose, picture, plan, and part, why are they here? What results are they looking for? And what do they look like now? Their picture. What's the plan? What's the part that everybody plays? Once we know that, then we can make assignments that are appropriate. So step number 1 has to do with making assignments. I find that this is a difficult issue throughout my work throughout the United States. Then shift report or other kind of handovers. Do we use the 4 Ps in our handovers? Thirdly, do we make a plan for the shift and set up our initial direction to assistive personnel that is effective initial direction. Fourthly, how do we round and make that initial introductory connection with our patients and families? Fifthly, how do we plan in partnership with the patient? What are those healing moments looking like? Six, once we know what the patients and families' immediate goals are, the 4 Ps for them and their long-term goals, how does that get communicated to other members of the team? And we do that through checkpoints and huddles and reconnecting throughout the episode of care. Then we make sure that we're integrating all that information with the rest of the interdisciplinary care team during our rounding. Usually, could be in discussions with them, but also if we do rounds or huddles or debriefing, we want to make sure all disciplines are involved in that in some way. We make sure the checkpoints are happening for teamwork with assister personnel. We use the feedback process, so we make sure we do that end of shift debriefing. That is absolutely essential. End of care debriefing, end of case debriefing. And then we use a critical thinking problem solving process to help the next shift or the next group that's going to be caring for these people and patients to be able to know how to proceed more effectively. So those are our 10 steps, and depending on where you're working, these can be implemented in different ways. Worksheet 6B asks us then to look at those 10 steps and where your organization or your unit or department is strong and where you think there are some gaps, because what we're doing with evaluating and identifying gaps is that it gives you an opportunity to look at where you're going to develop a critical thinking problem and solve that issue and then bring that to the other members of the team. So we also ask you then to use your indicator tools. So depending on where you're working, in your appendices and also online, in the student part of the website, you can look at different kinds of tools that you can use depending on where you're working to evaluate your baseline level of care as it stands today. One is your evaluation of team performance. You might see this. This will be online, or you can ask us for it if you have trouble indicating that you can't find it or something. Let us know. We'll send it to you. You have, like on page 62 of this particular portfolio, you have your inpatient care unit indicators and desired outcomes, so you can evaluate what's going on your shifts. Find out from the person who's sponsoring this coursework, or a coach or someone who's coordinating the work that you're doing in this course, to find out, is there a plan in place for everyone to be able to really evaluate how the care is being given, and whether or not there's a place that you're going to be taking that information and assembling it to get a good look at how things are going. We have one for outpatient therapies, for the perioperative area, which is also emergency department, another set of indicators, and all of these have been developed with expert practitioners in those particular areas of care provision. Ambulatory care clinic assessment, home health assessment tools we ask you to look at if you're in home health or if you supervise home health. There's also a self-assessment tool that some of the same questions that you were asked on your online self-assessment. There's a long-term care assessment tool, an evaluation of progress for your perinatal areas, and also for psychiatry or behavioral health, there's also a tool for that. So if for some reason you can't find a tool that works for you and you're in an area that we haven't covered, let us know and we'll help you develop some kind of a way to evaluate how care is actually being given in those areas that you work in. So this has been section 3, and you'll notice that now the next section we'll be discussing will be section 4, organizational review. So we're going from your particular area that you're working each shift, and then we're going to move up to some review of the entire organization and how your organization is implementing the professional practice. Thank you very much for joining us for Section 3. We'll see you soon and talk about Section 4.